Good afternoon, everyone. We'll wait just a few more seconds or minutes here to allow others to be able to join us. We'll be getting started shortly. All right. Well, welcome and thank you for joining this afternoon. Just a few meeting logistics as we prepare to get started. This webinar will be recorded. Please make sure your microphone is muted. Throughout the presentation, you may type questions using the Q&A portion at the bottom of your screen. The slides and the recording from this presentation will be posted to the funding opportunity page, and that link is being provided for you in the chat. To access the caption service, click on the CC icon at the bottom of your screen. Welcome to the Special Supplemental Nutrition Program for Women, Infants, and Children, also known as WIC Workforce Implementation Projects FY24 RFA Technical Assistance Webinar. My name is Corinthia Cherry, and I'm a National Program Leader in the Division of Nutrition in the Institute of Food and Agriculture at the National Institute of Food and Agriculture, or NIFA for short, at the United States Department of Agriculture, or USDA for short. I'll be presenting today with my colleague, Julie Sklomowski, Senior Technical Advisor in the Office of Innovation in the Supplemental Nutrition and Safety Programs at the Food and Nutrition Service, or FNS for short, and that's also a part of USDA. Before we get started today, here is our non-discrimination statement. In accordance with federal civil rights law and USDA civil rights regulations and policies, the USDA, its agencies, offices, employees, and institutions participating in or administering USDA programs are prohibited from discriminating based on race, color, national origin, religion, sex, gender identity, including gender expression, sexual orientation, disability, age, marital status, family or parental status, income derived from a public assistance program, political beliefs, reprisal or retaliation for prior civil rights activity in any program or activity conducted or funded by USDA. Remedies and complaint filing deadlines vary by program or incident. Please note that the slide contains contact information for individuals with disabilities to request reasonable accommodations. Language access services will be provided to limited English proficient individuals upon request. And anyone wishing to file a complaint can utilize the phone number, fax number, or postal mailing address listed on the slide. And the link to the non-discrimination statement will be provided in the chat. I would also like to start with introducing the WIC Workforce Initiative team. The team is comprised of individuals from 2 USDA agencies. From NIFA, we have Suzanne Saluka, Shushan, Steve Zhang, Sheila Flashhiker, myself, Corinthia Cherry, Jamalise Ocasio, and Shakivia Shepard. From FNS, we have Amy Herring, Julie Sklomowski, Ebony James, and Laren Baker. During today's webinar, we will cover the following topics. First, we will provide an overview of NIFA, and Julie will provide an overview of the WIC modernization efforts. Then we will provide an overview of the WIC Implementation Projects Program, details for the RFA, program evaluation process, and additional resources. NIFA overview. So what is NIFA? We are the lead federal agency that provides extramural funding for food and agricultural sciences. We were created through the Food Conservation and Energy Act of 2008, and we invest in and support initiatives that ensure the long-term viability of agriculture. In addition, NIFA provides funding and strategic leadership for programs that ensure groundbreaking discoveries in agriculture-related sciences and technologies. Here's the list of the topics covered by all NIFA programs. The WIC Workforce implementation projects fall under the food and nutrition security topic. Now I will pass the presentation to Julie, who will provide an overview of the WIC modernization initiatives.
Thank you. Thank you, Corinthia. I'm here to cover the Food and Nutrition Services role in the WIC Workforce Joint Agency Initiative, including how it fits into USDA's overall WIC modernization efforts. WIC's official name is the Special Supplemental Nutrition Program for Women, Infants, and Children, although the program is widely known as WIC. This multi-year WIC Workforce project will invest in research, education, and extension to address issues in the WIC workforce with the ultimate goal of improving the WIC participant experience. Before I talk about our modernization efforts, I want to provide a bit of background on the program. Congress established WIC 50 years ago. The USDA Food and Nutrition Service administers WIC federally under agreement with 89 state agencies, including the District of Columbia, 33 Indian tribal organizations, and 5 US territories. Certain features of WIC are managed at the state agency level, such as WIC applications, the WIC management information system, and the approved shopping list. State agencies enter into agreements with a variety of organizations to provide services locally, including but not limited to local health departments, hospitals and other healthcare organizations, public health organizations, nonprofits, and the Indian Health Service. WIC provides healthy foods, nutrition education, breastfeeding promotion and support, and healthcare and social service referrals to women, infants, and children under age 5. WIC staff may refer families to medical or dental care, mental health services, or community-based support for other challenges they may be facing. Although the WIC foods are commonly associated with WIC, this entire set of benefits together makes WIC the effective public health nutrition program that it is. The American Rescue Plan Act of 2021, or ARPA, provided FNS with $390 million to carry out WIC outreach, innovation, and program modernization efforts. Our overall WIC modernization goal is to increase WIC enrollment and participation. FNS conducted more than 30 listening sessions with folks who work with WIC or may be affected by WIC from around the country. FNS then used this input, along with research gathered by the U.S. Digital Service, to establish a goal-driven investment framework to increase WIC participation and improve equity in program delivery. Our overall WIC modernization goals focus on enrolling all eligible families, making WIC attractive so that families stay on the entire time they're eligible, making shopping simple and convenient so that families can use all of their benefits, and making WIC equitable and accessible for all. WIC is a critical public health program that supports some of our most vulnerable community members at critical life stages. Studies have shown for decades that WIC improves the health of participating women, infants, and children. However, WIC is only reaching about half of those who are eligible for the program. We have invested portions of the $390 million provided by Congress across 4 key priority areas. These include outreach, modernizing technology and service delivery, improving the shopping experience, and supporting the workforce. We have invested over $200 million of those dollars directly into grants to states to support these goals. The rest of the funding is being used for federally run projects like this workforce initiative. Modernizing the program will make WIC easier to access, more useful to families, and more relevant to cultural and lifestyle needs. We believe these are critical factors that need to be addressed to improve enrollment and retention. Supporting and developing the WIC workforce is essential to our modernization efforts. Those that attended listening sessions voiced support for workforce development initiatives. These included developing educational and career pipelines for WIC staff, providing resources and training to improve cultural competency, and strategically addressing concerns around staff retention. The University of Minnesota Extension, under a prior cooperative agreement as part of this initiative, helped us with a very important first step. The University of Minnesota team developed the National WIC Workforce Strategy with input from WIC state and local agency staff. The strategy informs how best to invest the remaining available funds to respond to the concerns that the current WIC workforce shared and to meet their needs. 2 RFAs have been released to directly support implementation of the National WIC Workforce Strategy. The WIC Workforce Implementation Projects RFA, which we're talking about today, and the WIC Evaluation and Technical Assistance Center RFA, which was covered in a webinar yesterday. Outcomes from this work will serve as a workforce model for the broader nutrition education workforce at local, state agency, and federal levels. Nutrition services professionals working in WIC are deeply committed to the work that they do. In the WIC clinic, competent professional authorities, known as CPAs, conduct nutrition risk assessments and prescribe WIC food benefits. They also provide nutrition education, breastfeeding promotion and support, and make referrals to other health and social services. We understand that state agencies most commonly hire registered dietitians and master's level nutritionists as CPAs, followed by bachelor's level nutritionists and registered nurses. We're interested in better understanding the current landscape of WIC staffing models and exploring opportunities to address our WIC workforce challenges while continuing to deliver high quality nutrition services. Paraprofessional peer counselors are currently employed in many WIC clinics to support breastfeeding. Nutrition paraprofessionals are also currently employed in some WIC clinics. We're interested in better understanding current nutrition paraprofessional models and how they can be applied more broadly. Defining staff qualifications along with roles and responsibilities will help us to ensure that participants receive quality services. This will in turn impact WIC participant recruitment and retention. WIC professionals provide nutrition services both in person and virtually. Providing nutrition services virtually is a newer feature of WIC, so training is needed to support WIC staff as they build skills and confidence to deliver the same high quality nutrition services in a different environment. WIC staff participate in continuing education both in person and virtually. Training may be offered at the state and local level. Training materials and models must meet the needs of WIC staff and fit into their day-to-day responsibilities. Developing and strengthening the WIC workforce is key to the success of our WIC modernization work. For decades, WIC clinics have strived to meet the comprehensive set of needs of their service communities while providing culturally responsive care. During listening sessions, stakeholders conveyed that increasing diversity and cultural competency in the WIC workforce could potentially increase WIC participation and retention, particularly among historically underrepresented communities. To provide culturally competent care, WIC nutrition professionals that complete nutrition assessments, prescribe food packages, and provide nutrition counseling and education must understand the cultural food preferences of the families they serve. Recruiting, training, and retaining WIC workforce that is representative of the WIC population will help maximize WIC's full potential to support healthy pregnancies, growth and development of infants and children, and postpartum recovery. The recommendations outlined in the WIC Workforce National Strategy and the priorities outlined in these RFAs will help us achieve our goals. Thank you so much for your interest in helping us to invest in and support the WIC workforce. More information on our WIC modernization efforts is available on the USDA Food and Nutrition Service website. Our URL is on the slide. I'm now going to turn it back to Cynthia, and she's going to walk through the RFA.
Thanks, Julie. Before we dive into the program overview, I would also like to remind everyone that all interested applicants should read the RFA. This webinar shares the core information in the RFA, but there is no substitute for the RFA itself. The RFA should be considered the primary reference document for this funding opportunity. An applicant should ensure that they have carefully read the RFA before beginning an application. With that established, let's begin with a quick look into the WIC Workforce Implementation Projects Program. Before going into details regarding the Implementation Projects RFA, I need to discuss the foundation that the implementation projects are to be built upon. As you heard from Julie just a little while ago, that foundation is the National WIC Workforce Strategy. The entire WIC Workforce Initiative is part of a joint agency effort between FNS and NIFA that is expected to cultivate comprehensive and sustained solutions for WIC workforce development and support. The initiative aims to strengthen the diversity and cultural competency and address barriers to recruitment and retention of the WIC workforce. The ultimate goals are to increase 1, WIC participation, so through reaching those populations that are eligible but not enrolled, and 2, WIC participants' use of benefits and services, including nutrition education and breastfeeding support. The WIC Workforce Implementation Projects Program that we are focusing on in today's webinar is one of the first funding opportunities resulting from the national strategy. Links to the national strategy have already been provided for you in the chat. Again, the National WIC Workforce Strategy is the result of a cooperative agreement between USDA and FNS and NIFA and the University of Minnesota Extension. Their goal was to identify evidence-based strategies to inform the design of a 5-year plan to strengthen the WIC workforce. The strategy highlights key needs across objectives that will result in a WIC program that is innovative in meeting the changing needs of families, a supported WIC workforce, the ability to hire and retain the best talent, improved reach to populations that are eligible for WIC, but again, are not yet enrolled, and enhanced likelihood that WIC participants adopt nutrition education and breastfeeding support recommendations. Please be mindful that the National WIC Workforce Strategy should be considered a key resource when you're developing your proposals. So what are the purpose and priorities of this WIC Workforce implementation projects? The WIC Workforce implementation projects will align with that National WIC Workforce Strategy, including approaches that will increase the diversity and cultural competency of the WIC workforce. Each WIC Workforce implementation project will be expected to coordinate with the WIC Workforce Evaluation and Technical Assistance Center and develop outreach plans for engaging with WIC state and local agencies, Indian tribal organizations, territories, tribal colleges and universities, and minority serving institutes. They will also be expected to engage to develop engagement and outreach plans that should incorporate activities and outcomes, including traditional ecological knowledge. A critical note here that I want to mention: the implementation project's request for proposals was released at the same time as the evaluation and technical assistance RFA. And as Julie stated, we covered that in a webinar yesterday. What we want you to remember is that these two funding opportunities are intricately linked. The Evaluation and Technical Assistance Center will provide support to each implementation project, and applicants for the implementation projects RFA are encouraged to read and review the Evaluation and Technical Assistance Center RFA as well. The link to the Evaluation and Technical Assistance Center RFA was placed in the chat earlier. Eligibility. Applicants for the WIC Workforce Implementation Project Program must meet all the requirements discussed in this RFA. Failure to meet the eligibility criteria by the application deadline may result in exclusion from consideration or preclude NIFA from making an award. For those who are new to federal financial assistance, NIFA's grants overview provides highly recommended information about grants and other resources to help you better understand the federal awards process. Eligibility includes the organizations listed on the slide above. They are state agriculture experiment stations, colleges and universities, university research foundations, other research institutions or organizations, and nonprofit organizations. Eligibility also includes the organizations listed here and any group consisting of 2 or more entities mentioned on this slide. It is also important to know that eligible institutions do not include foreign or international organizations. So there are several implementation project program areas that I'm going to discuss. NIFA is soliciting applications under the program areas shown on the slide. As appropriate, the WIC Workforce implementation projects must again align with the recommendations outlined in the 5-year National WIC Workforce Strategy. This strategy was developed to shape investments in supporting the current and the future WIC workforce. They must also support specific needs outlined by USDA in the RFA and to support the overall goals of the ARPA-funded WIC modernization. The 6 program areas are documentation of staffing models and recommendations, nutrition paraprofessional projects, scholarship funding, programs to support training credentialing of WIC staff, development of training materials, development of training model and pilot, and novel proposals. So the first implementation program area is documentation of staffing models and recommendations. All of the projects funded under this opportunity will be cooperative agreements, and we'll talk a little bit more about what that means in just a few minutes. The duration is up to 48 months, and 1 award is anticipated. The maximum award amount is $5 million. Projects must research and document both state and local staffing models across WIC and similar public health or nutrition assistance programs. Some more details about this program area. Proposals submitted under this program area must assess, at a minimum, all of the following listed here: the authority to make changes to position descriptions, job titles, pay, and benefits at the state and local levels, The steps on how WIC state and local agencies make these staff changes while receiving the support of their current and future staff. How competent professional authorities, those CPAs that Julie talked about, how are they defined and utilized in different state agency models? Pay and benefits by position, demographics of WIC staff relative to the communities they serve, similarities and differences across rural, urban, and tribal communities, and use of contracted and remote staff. Projects under this scope must research and conduct a job study that explores work that must be performed at every layer of WIC delivery. In addition, once the job study is complete, the project must conduct a compensation analysis to determine the market value of different WIC specialized key roles. The research must also address what is effective and what is not effective across staffing models currently being implemented in WIC, specifically related to the key elements of the national strategy. The proposal must include how effectiveness will be determined, including but not limited to competitiveness of pay and benefits, geographic region, or cost to operate within the same geographic region. The research must also include a set of staffing models along with considerations for improving or changing existing staffing models, again, related to the strategy. Projects proposed under this scope must include products, and some examples of those products are toolkits, how-tos, or webinars. And these products will assist WIC state and local agencies in assessing their current staffing models against the new staffing models and help them make decisions about what potential changes they can implement. And it's also important to note here that these products must be appropriately disseminated to all WIC state and local agencies. And I know we're talking about a lot of information, but please refer to the RFA as well, and you'll find even more details there. The next program area is the Nutrition Paraprofessional Projects for WIC. The program code, grant type, duration, and anticipated number of awards and amount are listed. Projects here must research and document current paraprofessional staffing models across WIC. Projects under the WWNP program area must consider research findings on staff members, consider paraprofessionals, and recommend a new title for these staff. Another quick note that I want to mention here, the term paraprofessional is currently used inconsistently across WIC and state and local agencies. Staff who provide nutrition and education and breastfeeding support but are not registered dietitians are often called paraprofessionals, no matter what degrees they hold. USDA expects that job analysis projects centered on the WIC workforce will inform appropriate qualifications for paraprofessionals, but would like applicants to be aware of the multiple interpretations of this term while you are assessing current models and programs. Projects must develop and pilot paraprofessional projects to support nutrition services in WIC. And projects must also develop competency-based training and continuing education opportunities appropriate to assigned duties within WIC. Projects must have the ability to be scalable to multiple states or local agencies. And projects must also be tailored culturally as appropriate. And before we go to the next area, there's also particular interest in models designed to operate in areas where recruitment of registered dietitian nutritionists, RDNs, and other credentialed practitioners is particularly challenging. And here we're talking about some of those rural, remote, or tribal communities. Paraprofessional projects must also include the following at a minimum: training and support resources for prospective paraprofessionals, training and support for resources for staff managing these paraprofessionals, clinics, WIC, local and state agencies, and evaluation of project effectiveness. Again, please refer to the RFA for additional details. The third implementation project program area is the scholarship or funding programs to support training or credentialing of WIC staff. Again, the program code, grant type are all listed for you. Projects under this area must research and document scholarship or funding programs that currently prepare students for prospective WIC careers. This research must assess at a minimum all of the following: current scholarship or funding opportunities targeting Black, Indigenous, and people of color or BIPOC students, areas of study, including but not limited to nutrition, public health, maternal and child health, nursing, social work, and other majors that would prepare individuals to work in WIC. Programs that currently prepare students for nutrition and maternal and child health, or other public health careers that lead to guaranteed long-term employment. Demographics across programs described above to determine the proportion of scholarship funding going to BIPOC students and whether any programs described above only target BIPOC students. Also, this program area must address existing WIC, maternal and child health, and or public health dietetic internships at the state and local level, and those employment or retention rates. And finally, also, this area must address the availability of two-year degree programs that would provide specialized skills to perform WIC duties. Continuing with this program area, this research shall include programs that support undergraduate students prior to entering a career path and support continuing education for those already working in WIC to advance their careers. The research must address, again, what's effective and what is not effective across scholarship and funding programs currently being implemented to target BIPOC students. Projects should propose recommendations for establishing a scholarship or funding program for BIPOC students. And projects could propose and establish a pilot scholarship or funding opportunity based on the results of your research. The fourth implementation project program area is the development of training materials. Again, all of the program codes, grant types, and durations are listed for you. Projects under this program code must focus on development of training materials aligned with recommendations in the strategy. Again, that reference to the strategy, so you are encouraged to use that as a resource as you're developing your proposals. Projects under this program area must focus on development of training materials aligned with the strategy. In this program area, the project must include an inventory and review of existing training materials available on specific topics prior to the development of new materials. All training materials must be developed and piloted based on human-centered design principles with current WIC, state, and local agency staff. There must be training related to nutrition assessment and counseling, and it must complement or improve upon USDA's current guidance and training and any other applicable policy and guidance. Training should be developed so that it can be included in FNS's current or future training platforms, as well as state agency learning platforms. The next implementation project area is the development of a training model and potential pilot. Those same details are listed here, including program code, grant type, duration. The project under this program code must focus on developing and piloting a training model based on the second recommendation in the strategy. The model must be based on human-centered design principles with current WIC state and local agency staff. Peer coaching and mentoring is encouraged for inclusion in the model. The model must be replicable and transferable, and piloting in the later years of the project timeline is highly encouraged. The final implementation project program area is novel proposals. The program code, grant type, duration, and anticipated number of awards and amounts are listed. USDA will accept novel proposals addressing one or more of the components of the strategy that haven't been explicitly outlined in this RFA. Selection of novel proposals will be based on the following factors: merit and quality of the proposal, including staffing that includes appropriate subject matter experts, likelihood of accomplishing overall ARPA-funded WIC modernization goals, likelihood of success in WIC, and availability of funds. So next, we're going to switch gears and talk about administrative requirements. In this section, I will provide an overview of the administrative requirements of the RFA, such as award type, pre-award requirements, indirect cost recovery, budget, and budget justification. The determination of award type is based on principal purpose. In this case, the principal purpose is to support or stimulate recipient activity, and to do so with substantial programmatic involvement by the federal agency beyond normal monitoring responsibilities. So this award, or all the awards under this announcement, will be made as a cooperative agreement. This means that FNS and NIFA will be substantially involved in carrying out the project, and the specific terms and conditions of NIFA's involvement may be applied. Some examples of substantial involvement may include additional regular check-in meetings, sharing of data, or development of reports. And all of these awards will be cooperative agreements. Applicants must submit specific management information relating to their entity prior to an award and update the information as needed. Some examples of documents that may be required during the pre-award process include single audited financial reports or certified year-end balance sheets and income statements, documentation of policy on salary compensation, and listing of federal grants. And all of these requests would come from our awards management division. Indirect costs. This funding opportunity allows for the full recovery of indirect costs, or IDC, based on your current negotiated rate established by your cognizant federal agency. For more information on indirect costs, please refer to the link that's being provided in the chat. Budget and budget justification. Applicants are required to provide information about their budgets. Applicants must submit a budget justification to provide details about the costs associated with their project. All grant costs in the budget must be reasonable, allocable, and necessary. They must be reasonable, meaning they must fall within the scope of allowable costs, and a prudent person in similar circumstances would incur this same cost at the same proposed rate. Costs must be allocable. This means they must be directly related to specific grant activities and contribute to grant objectives. And they must also be necessary. The cost must be essential to accomplishing the grant objectives. Cost share or matching. There is no match required for this funding opportunity. Matching resources will not be factored into the review process as evaluation criteria. Application details and documents. NIFA only accepts electronic submission of applications. The NIFA Grants Application Guidelines, or this guide, is available through grants.gov. A SAM, Unique Entity Identifier, or UEI, is now required in place of a DUNS number. All application documents must be in the portable document format, or PDF format, to be accepted by NIFA. This includes your narrative and your budget justifications. Please remember that grants.gov may allow uploading of other formats, but NIFA does not. And please don't use third-party PDF builders. Please also make note of the application deadline date and time and the maximum award amount for these funding opportunities. There is no NIFA restriction on proposals per institution, but you may want to check with your individual institution and see if they have any restrictions. Duplicate submissions are not allowed, and I'll discuss that more in just a second. The duplicate submission or multiple submissions instruction refers to submitting the same application to multiple programs or requests for applications. This is not allowed by NIFA. So if the application you plan to submit to this request for applications is the same one that you have submitted or will submit to another program, the last submission will be disqualified. Institutions are allowed to submit multiple times the same applications, such as if there was a missed document in the first submission. But please take into consideration that NIFA will consider for screening only the last version that was submitted on time. Be sure to include all documents again in PDF in that last version. An institution or PI is allowed to submit multiple completely different applications to the same program or request for applications. This includes having a different project summary, project narrative, especially the objectives, and all other required supporting documents should reflect that this is a different application. Application details. You must include your project summary or abstract. Your project narrative has a 15-page limit and it will be strictly enforced. The font type, spacing, font size for figures will also be explained in the RFA and are listed here, and you should make sure that you follow those guidelines. You must include your introduction, project goals and intended outcomes, personnel, organizations, and resources involved, your approach, and please make sure that you include a timeline. You must include a logic model and a data management plan as well, and we'll talk a little bit more about that data management plan later. So the data management plan is required for this program. Investigators must provide a detailed, up to 2 pages data management plan, including expected data type, data format, data storage and preservation, data sharing, protection, and public access, and roles and responsibilities. You can also review the data management plan for NIFA funded research projects for more information. And we'll also provide that link in the chat for you. Other key components or documents that you'll find are listed, that you need to submit, are listed here. And again, the NIFA grants application guide is part of the application package for this RFA, and you can access that in grants.gov. But please note, if there is a discrepancy between the two documents, the RFA overrides the application guideline. Remember that the RFA is your primary resource. So the RFA overrides anything that's in the application guide. Applicants that do not meet the application requirements to include partial applications risk being excluded from NIFA's review. Applicants must refer to the proposal number when corresponding with NIFA. And again, another reminder that key documents, all documents listed here must be in PDF format. The proposal evaluation process. So the initial screening criteria are listed for you. To avoid any misunderstandings, applicants should be aware that applications that do not satisfy all the initial screening criteria are at risk of being returned without review. Return applications may not be resubmitted with or without revision under this solicitation. The initial screening criteria are the following. The applicant must be an eligible entity as described in this RFA. The application must meet the application content and format requirements as described. This includes page length requirements for all required forms, and all files must again be in PDF. You must include your data management plan, and it must be in PDF. The application must include a logic model, and it must be in PDF. And the application must also include a management plan in PDF. The specific evaluation criteria is spelled out for you in the RFA, and I'll cover it briefly here. The first area is relevancy. The proposed work will have an impact on the joint agency initiative to strengthen the diversity and cultural competency and address barriers to recruit retention of the WIC workforce. The models and strategies proposed will improve the WIC workforce consistent with the strategy. We're also going to look at technical merit. Activities, objectives, outcomes, and potential impacts must be clear and achievable within the project period, as well as adequate to fulfill the purpose and priorities of the implementation projects. The qualifications of the project team, partners, and collaborators is also an evaluation criteria. Participating organizations, institutions, and key personnel roles must be clearly defined. Other details are listed in the RFA. And the final area of evaluation criteria is project management. The project management plan and data management plan must involve stakeholders that are included in the project design, development, implementation, data sharing, and reporting. A clearly articulate plan to accomplish the project objectives must be listed, and you must illustrate sufficient time that will be allocated to accomplish each objective. Again, there's lots of information that I won't read from directly from the RFA, but please refer to the RFA because this is the evaluation criteria that will be used to evaluate your proposals. So what does the peer review process look like? This peer review process is the same process that applies to all NIFA funding opportunities. Proposals are assigned to reviewers with expertise in the proposed topic. Then the reviewers will produce individual reviews, which will be used for a panel discussion. Through that discussion, peer review panelists come to a consensus on the final ranking of the proposals. Again, please review the evaluation criteria that we just talked about for additional information on what the panel will be looking for. Some common mistakes to avoid. Make sure that the page length requirements are correct. Make sure that all your documents are in PDF format. Make sure that you include all parts in the project narrative. This includes the introduction, the logic model. We've talked about this. Your approach must have a timeline. So make sure that you review everything carefully. And you must submit proof of eligibility. And this is specifically for IHE, and this is Institute of Higher Education applicants. Review that your budget is within the maximum award amount. Make sure that you're attentive to the due date. Late submissions represent an automatic decline, and a project budget request that exceeds the maximum allowable award amount is also an automatic decline. And the last section is resources and contact information. The resources on this slide can help you create a successful application and provide more detail about many of the topics we discussed today. Please note that of all the resources that NIFA provides, the RFA is the most important and should be considered the primary authority on this funding opportunity. Most of these resources have already been provided to you in the chat, but we'll completely put the others in there for you as well. And especially the grants application guide. If you have any questions that we haven't answered or that we are not able to answer by the end of today's session, please reach out to us via email listed here. Myself, Corinthia Cherry, and our program specialist, Jamilis Ocasio, and we have our email contact here, and this is a monitored email box, so please feel free to reach out to us there. We thank you for participating in this technical assistance webinar, and at this time, we'll take any questions. I'm going to check here. It looks like there's no open questions or questions that haven't been answered at this point. Are there any other questions that need to be placed in the chat? We will be having these slides and this presentation today, this webinar, will be posted to our funding opportunity page, so you'll be able to review those later. We do encourage you to review the RFA completely and thoroughly. We also encourage you to look at the NIFA application guide and also refer you back to the evaluation and technical assistance webinar slides as well, because again, these two opportunities are very much linked. Any questions? We'll give you a couple more seconds here to think about that before we close out for today. But again, these slides will be posted. And if you think of questions later, please feel free to reach out to us. Seeing no additional questions in the chat, we do thank you for participating today and look forward to receiving your proposals. Thank you.